Hello family, hi, welcome to Amazing Growth again. My name is Antoinette Hunter. If this is your first time watching this channel, you are very welcome. I am a teacher and a developmental intervention specialist. So on this channel, I give techniques and strategies on working with children with disabilities and developmental delays. I also do activities, preschool activities on this channel. So I welcome you to continue watching my video, and please don't forget to share. On today's video, I am going to be talking about something very interesting that most people have concerns about, especially when I go out in the field or in the classroom. My parents sometimes will call me or pull me over and ask me questions. And one of the questions that they ask is speech. A lot of time we have the preschooler having difficulties communicating. So the discussion here is we are going to be discussing symptoms of autistic speech delay. Is the child's speech delay is related to autism or not? So the difference between autistic speech delays and other delay is fairly easy to spot. If you recognize that your child is not talking, it may be a good idea to consider having your child evaluated for autism, or your child have very limited words or speak in single phrase that communicate in single words or very short phrases. Depending on the age of the child, you want to consider having your child evaluated for autism. Now, I'm not saying that because your child is not communicating, your child has autism. All I'm saying is if you do have concerns, please don't ignore it, because the earlier you take care of it, the better your child will be able to function. I'm going to give you a few scenarios, and the first one, I'm going to pick a name, and please, none of these kids, the names I'm choosing is a name that it's just a pseudonym, meaning make-up names. So let me say, for example, Christy isn't talking at all at the age of 2, okay? But why she isn't saying any word yet? She's using babbling sounds and body language to communicate with people around her. She's pointing, pulling people towards things. She works on getting her wants and needs and engage with other people around her. She actively enjoys playing with friends, parents, and siblings. She's frustrated when left alone to take a nap. Now, Pabs is the same age as Christy, but Pabs does have a few words, but she doesn't use them to communicate. Instead, Pabs repeats them over and over to himself. But Christy has not yet figured out how to use words or gestures, sounds, or words to ask for something she wants. So Christy, on the other hand, is not using any of these things, but can take you to what she wants, can pull you, and can, direct you to her wants and needs. So her parents find it very impossible, or almost impossible, to hold conversation or attention for more than a few seconds. Now, Christy may have speech delay that requires some form of early intervention. Possibilities include, but are not limited to, hearing loss, apraxia of speech, a problem with control of muscles used in speech communication, cognitive thinking challenges. Although Pops is able to use a few words, he may be showing an early sign of autism. The fact that he's using more words than Christy does not mean that it's okay, because Pop's situation seems to be a little more, it seems to be much more different from Christy. Now, with this scenario, I am going to give you speech-related signs of autism. So in addition to late speech, there are a number of other communication-related issues that could be a sign of autism. Generally, children with autism are more likely to fail or be slow to respond to their names or other verbal attempts to gain their attention, fail or be slow to develop gestures such as pointing, showing things to others. So you want to make sure that you pay attention to these signs. I have given also those techniques and strategies in most of my videos because it seems to be very common and correlated. They can be cooing and babbling in their first development of life, but then stop doing so. Develop language at delayed pace is very common. So they'll develop language at a delayed pace. Learn to communicate using pictures of their own sign language. Speak only in single words or repeat certain phrases over and over. Seeming unable to combine words into meaningful sentences. Repeat words or phrases that they hear. A condition called echolalia is very common with children with autism. They use words that seem odd, out of place, or have special meaning known only to those familiar with the child's way of communicating. So if you're dealing with these children, sometimes it's going to be difficult to kind of like understand what they're saying, unless you've been dealing with them for a while. You might be, such as a caregiver, mom, parents, family members that are usually working with the child or being around the child on a daily basis or a lot, spending time with that child a lot. So communication can be difficult for another person to understand their wants and needs. Now, to just sum the whole thing, to make a long story short, I would say children with autism often have speech delays, but speech delays alone do not mean your child has autism. Autistic speech delay usually occurs along with other communication issues, such as not using gestures, not responding to their names, and not showing interest in connecting. Other possible causes of speech delays include hearing loss and developmental delays. Now I'm just going to give you guys just a little advice and suggestion that if you are worried that your child may have autism, it's a good idea to have them evaluated. I have said that before and I'm saying it again because I think it's important for you to keep that in mind. If the pediatrician determines that your child significant speech delay is connected to autism, you'll be able to start therapy early and give your child the best chance of gaining effective communication skills. That's the reason why I keep pushing that you should go ahead and have your child evaluated. Thank you guys for watching. I hope this video helps. See you guys next time, and thanks for your support. Goodbye.